The expression kidney infection can allude to a condition that extraordinarily diminishes the working of the kidneys. A few types of kidney infection are intense, which implies that the harm is unexpected and side effects uncover themselves rapidly. Ceaseless kidney ailment (CKD) implies that the decrease in the kidney capacity is moderate and dynamic. Numerous individuals live with CKD for quite a long time without staying alert that the kidneys are the wellspring of their medical issues, as there are not many or no indications in the underlying phases of CKD. The two kinds of kidney sickness, constant and intense, can be because of auto-resistant issue, ingested poisons that the kidney has been compelled to attempt to sift through, pharmaceutical drugs, or diseases. Certain different sicknesses, for example, hypertension and diabetes, put additional weight on the kidneys and can make them work worse than average, in the long run adding to CKD. One of the kidney's capacities is to separate squanders, which we wipe out in our pee, from the significant materials that should be returned onto our circulation system. Proteinuria, a consequence of numerous kinds of kidney malady, happens when protein, for the most part egg whites, spills out into the pee, causing our protein levels in our blood to turn out to be excessively low. We need protein in our blood to keep liquid inside the veins, and without it the liquid breaks into the tissues and blood is discharged through the pee. This is known as nephritic disorder. Ceaseless pyelonephritis is another basic kidney affliction. It is a difficult condition that happens when contamination discovers its way into the kidneys and causes incessant aggravation. Hematuria, the nearness of blood in the pee, can result from this kind of kidney contamination. Kidney stones can happen when an individual has a development of an excessive amount of calcium oxalate or uric corrosive in their pee, and it solidifies into a precious stone-like stones that can be extremely agonizing to pass. Contaminations can happen with kidney stones also, on the grounds that the kidneys are not ready to flush themselves out appropriately, causing a lethal domain where microscopic organisms can promptly develop. Hypertension, or hypertension, and the drugs used to treat it, can mess kidney up. A blockage of one or the two conduits prompting the kidneys can create, and the kidneys react by discharging an excessive amount of a substance called vasopressin, which causes the circulatory strain to rise surprisingly. Polycystic kidney malady is a hereditary issue where growths start to shape in the kidney. A portion of the growths don't cause any dynamic kidney disappointment, and others, contingent upon their size and area inside the kidney, can significantly hinder the kidney playing out its legitimate filtration. There is one essential kidney illness which is destructive, and that is renal cell carcinoma. The malignant growth will presumably cause agony or seeping in the region of the kidneys. Fortunately, this sort of malignancy is typically profoundly treatable. A few sorts of kidney conditions are delegated auto-insusceptible infections. Buerger's malady happens when the patient's insusceptible framework has set up antibodies that follow up on the tissues of the vessels in the kidney. Buerger's illness is otherwise called IgA nephropathy. Fundamental lupus is another immune system issue, and can make the body produce antibodies coordinated against the kidney layers. In an ordinarily working kidney, the sifting layers don't allow egg whites and other blood proteins to be discharged in the pee. Be that as it may, with foundational lupus, the separating films are disturbed, bringing about protein in the pee. As should be obvious, there are numerous kinds of kidney illness. In any case, on a positive note, the enormous number of shifted medications accessible gives us a wide scope of decisions to re-establish well-being to our body's filtration framework. There are numerous herbs and nourishing enhancements accessible that have been appeared to improve kidney well-being during both ceaseless and intense kidney infection. Not at all like the pharmaceutical medications accessible, these don't have any reactions and don't add to kidney harm while treating side effects. Common treatments can likewise treat the reason for kidney harm, offering long-haul security for your kidneys. Click the link in the description for more information.